Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is March the 31st. We are in week 56 of the COVID-19 pandemic here in Montgomery County. Today, we have some very, very good news about vaccine availability. But before I share that, I must emphasize that we remain in a very serious situation with new cases of COVID-19 in our community. All of our numbers continue to go in the wrong direction. As you will hear later, this week, all of our key indicators are up again. While we will soon be able to rapidly increase vaccine distribution, in the meantime, it is critically important that every one of us, vaccinated or not, continue to wear masks and maintain social distancing when outside of our homes. We are so close to the end, so close. Please stick with these important measures to keep everyone who is not vaccinated safe until we are able to vaccinate everyone who wants to be vaccinated. Our 3 mass vaccination clinics remain on track with first and second doses. We continue to receive 5,850 doses of Pfizer vaccine each week for our first dose clinics. In accordance with the Pennsylvania Department of Health order, we have scheduled out phase 1A appointments into the future for the entire month of April. I am very pleased and grateful to be able to tell you that Governor Wolf and his team announced earlier today that 42,000 doses of the Johnson & Johnson vaccine will be delivered to the county health departments in the 4 southeastern counties. There will be no Pima-run regional site. The delivery of Montgomery County's share of these doses will enable us to significantly accelerate the progression through our 1A list, as well as more quickly vaccinate a number of essential frontline workers. With 3 months of operations under our belt, we continue to improve our clinic operations. This week, we're moving to a new system to handle our vaccine clinic operations and appointments. This new Microsoft system will provide users a much better experience. It will eliminate link sharing and the need to use a token to book your appointment. On our screen, you can see what this new landing page will look like for this updated system. So don't be surprised if you see this, if you've seen our old one. This is our new system. And again, these links cannot be shared. And I'm sure many people are happy to hear this. You will not need to use that token in order to make an appointment. Now, just to be clear, anyone who is already pre-registered with us will maintain their spot on the list. We're just using a new software to manage our operations. As part of this transition, our registration button is down today on our vaccine page. It will reopen tomorrow morning, and I just want to thank everyone for their patience. But just to say that one more time, our pre-registration button is down today as we transition over to this new system. It will be back up at some point tomorrow. As a reminder, if you have any issues with making your appointment online, please email covid19@montcopa.org for assistance and include your name, date of birth, and if you have it, the date that you pre-registered in our system. As I've discussed in many previous briefings, the accurate collection of racial and ethnic data to inform our equitable vaccine distribution strategies is extremely important. April is National Minority Health Month, and this year's theme is #VaccineReady. Unfortunately, longstanding systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk for many diseases, especially COVID-19. These inequities, such as poverty, lack of health care and education access, systemic racism, economic instability, and unhealthy and unsafe neighborhood environments have all created barriers to equity in our healthcare systems. This inequity has caused 2 to 3 times more serious and fatal outcomes for our Black and Brown communities who test positive for COVID-19 compared to white populations. It underscores the need for these communities to get vaccinated as quickly as more vaccines become available. To that end, we've made sure that COVID testing centers have been accessible to those communities and are fighting to do the same with our vaccination centers. Vaccination is an important tool to slow the spread of COVID-19 and to help us get our families, communities, schools, and workplaces back together sooner. We're working hard to remove barriers so that all of our residents can achieve health equity and have the opportunity to be as healthy as possible. We've worked diligently to both ensure that the numbers of our residents vaccinated are high, while at the same time ensuring that vaccine administration is equitable and that there are no barriers to obtaining vaccine. This has led us to use a two-pronged strategy that prioritizes both mass vaccination clinics as well as targeted smaller clinics. To give you some examples of these smaller clinics, we'll be partnering with Bethel Community Church in Pottstown, where our bilingual health educator will register people for a weekly clinic at this church on site at the church's food distribution. The congregation serves primarily African American and Latino residents of the Pottstown community. We've also joined forces with the leadership of Norristown to support expanded vaccine access for people residing in area code 19401. This includes partnering with the NAACP, the Municipal Administration, and East Norriton Pharmacy to provide a clinic in the heart of the city, and it will continue to include registration sites throughout the city. We're also planning to provide transportation from the downtown area to the Norristown High School Clinic. We've also teamed up with the Skipek Pharmacy and the Jason Medical Center to vaccinate 300 people from the Korean, Chinese, Filipino, and Nepali communities, among others, this past weekend. Additionally, as Skipek Pharmacy has been vaccinating about 2,500 individuals at the North Penn High School on Sundays, the county is providing 1,000 individuals from our Phase 1A pre-registrant list. We also continue to meet weekly with county hospitals to strategize increasing access to diverse county residents, which has led to suburban hospitals setting up a Norristown clinic and Holy Redeemer Hospital setting up on-site clinics at affordable senior housing locations. And finally, our mobile vaccination unit continues to reach seniors living in congregate care facilities who would otherwise be unable to get to a county-run mass vaccination site. So far, we've vaccinated over 700 people and have many more scheduled for future dates. If you're scheduled to receive vaccine in the coming weeks, we ask that you please fully fill out your vaccination record and self-identify your race and your ethnicity. I understand that this is sensitive data, particularly in these times, but I just really ask you to fill this out. This is the way that we can make sure that we don't leave anyone behind in our vaccination efforts. And I can also assure you that the only reason that we are collecting this data is to make sure that we are getting to all communities that need access to vaccine. We'll also continue to ask our area pharmacies and other providers to partner with us to help us get vaccines out in an efficient and equitable way. We are really all in this together. Couple reminders about registration. The pre-registration for the COVID-19 vaccine remains available by phone through our COVID-19 hotline. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. To pre-register by phone, you can call the hotline at 833-875-3967 and just let the person who answers the phone know that you need support in pre-registering for a vaccine appointment. Once your information is in our pre-registration system, it will be placed in line to receive an appointment. When we have vaccine for you, a volunteer will call pre-registrants back on the phone and book that appointment slot for them over the phone. There's no need for callers to have a valid email address or internet access. We also want to remind residents that no-cost transportation is available to all vaccine appointments at Montgomery County vaccination clinics. There are currently 3 options through Transnet, SEPTA, and GoGo Grandparent for anyone who needs a ride to their vaccine appointment. Again, these are no cost as long as you're going to one of our sites, and we encourage anyone who needs transportation to call the numbers listed on the screen. For those of you who have already pre-registered on our site, we continue to send weekly emails to you to keep you updated on our vaccination progress and what you can expect when it's your turn. We've been working through our individual pre-registration list and continue to vaccinate 6,000 people per week. We're also cleaning our list and removing people from our list that received their vaccine elsewhere. As of this morning, we have 75,171 people remaining on our 1A pre-registration list. To date, we have sent 156,557 appointment notifications. So we are making some progress. So let's walk through the chart this week. As a reminder, the top row is the work of the Montgomery County Office of Public Health. So we have now received, as of yesterday, late afternoon, 62,870 first doses. And as of yesterday, at the end of the day, we have given 54,874 of those doses. So we have about 8,000 first doses left, which will be used each day until our next delivery comes next week. As you can see in the left middle column, that we have about a little over 75,000 people remaining on our list. Now, I will say that some of those folks have already gotten their vaccine. And we are finding that about 35 to 40% of people, when we reach out to them with an appointment, have already gotten their vaccine. So that number is probably a little smaller than what you're looking at, but that number is also complicated by the fact that we have healthcare providers who often have quite a few employees. And so we still have some of them, several thousand of them to work through as well. As of right now, we are scheduling people who have pre-registered on or before February the 10th. So again, good progress there. Now, in that bottom left corner, you can see how we're doing in total in terms of vaccinations. If we look at the number of people who've been vaccinated with one dose or are considered partially covered, that's 156,064 people. Fully covered, we have 97,515. So there are a total of 253,579 Montgomery County residents that are either partially or fully vaccinated. If we look at that as a percent of our total population, that is 30.52% of our total population. If we look at it as a percent of those who are 16 years of age and older, then we are at 37.67% of those individuals are either partially or fully covered. And I have an additional breakdown for you today, which is of our senior population. For seniors who reside in Montgomery County, that are between the age of 65 and 74 years of age, 67% have been partially or fully vaccinated. For the age group 75 to 84, 70% have been partially or fully vaccinated. And for those that are 85 and older, 68% have been partially or fully vaccinated. Then over on the right side, we have our review of our countywide race and ethnicity data. Our Asian group is holding steady from last week. Our African American group continues to tick up a bit each week, which is great news. We're up at 4.9%. And you can see the white and then the other or multiple races. Now, we continue to have 1 in 6 individuals who has not identified their race. So again, just please urge you to do that. And then in terms of ethnicity, we have 2% of the Hispanic Latino community are being of the people that we're vaccinating, 2% are identifying as Hispanic or Latino out of a county population of 5.4% or county proportion of 5.4%. And again, here we have 1 in 3 people who are declining to identify their ethnicity. So please, please help us out to make sure that we're not leaving anybody behind. To check your progress and our progress, you can visit our vaccine page at montcopa.org/COVID-19 vaccine and click on the link next to a blue flag that says status of vaccine registrants. This link will take you to a chart that lists how many individuals pre-registered each day since January the 12th. And if you know the date that you registered, you can see how many people are ahead of you and what dates we are registering from. And as I said earlier, currently we are registering people for vaccine appointments who registered on or before February the 10th. Moving on to our regular updates, since the March 24th press briefing, we have 1,304 new cases of COVID-19 reported in Montgomery County. This is for the dates inclusive of March 24th through March the 30th. This is a daily average of 186.3 cases and brings us to a total of 50,922. These positive cases are a result of a positive test for the virus, not from the antibody. 8 of these are from long-term care facilities. 1 is from the Montgomery County Correctional Facility. 1 is from Norristown State Hospital, and 22 are from other congregate settings. 1,272 are from the community. These positive individuals are from all 62 municipalities. Today's individuals range in age from 3 months old to 99 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographic information. Today, we have 641 females, 659 males, and 4 unknown. I'm sorry to confirm that 6 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,261 deaths confirmed positive from COVID-19. These 6 individuals ranged in age from 54 to 90 years old. 3 died in a hospital, 2 in a long-term care or congregate setting, and 1 at a residence. Overall, 637 females and 624 males have lost their lives to COVID-19. They ranged in age from 25 years old to 106. The racial breakdown of this group are 2 American Indian Alaska Native, 35 Asian, 9 Asian Indian, 6 Asian Korean, 151 African American or Black, 654 white, and 404 unknown. Our situation remains stable at the Montgomery County Correctional Facility. Any individual that has tested positive is in stable condition in isolation, and routine antigen testing is underway for all correctional officers. Our positivity rate has increased during this past week. Our 14-day average positivity rate is now 6.01% as of Thursday, March the 25th. Compared with 5.21% as of Thursday, March the 18th. And just as a reminder, this is our 14-day average positivity graph. The orange lines are the number of people who were tested on any given day, and the blue line is the 14-day running average. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph, shows the daily positivity rates for February the 26th through March the 25th. And you can see that the daily positivity rate fell below 5% on 10 of those days in the last 28 days. And certainly we are seeing it ticking up steadily over these last few days. Our hospitalizations are continuing to increase since last Wednesday. Today, 177 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is an increase of 40 individuals. We were at 137 last week. 9% or 16 of these individuals are requiring a ventilator. So just a reminder, our hospitals remain busy, and we have gotten nowhere near where we were back in October when there were 24 patients hospitalized in a Montgomery County hospital with COVID-19. Excuse me. In terms of testing, for the 14-day period ending March the 25th, 39,115 Montgomery County residents were tested. This is an increase of 2,275 people compared with the 14-day period ending March the 18th. So it's great to see so many people being tested. This is exactly what we want. This is our graph that shows you with the gray bars every date that people were tested and how many people were positive on that date. And you can see again over there on the right, our numbers are ticking up. We are, right back up to kind of similar to where we were last spring. Just as a reminder, the red and the pink are the 7-day and 14-day average of total cases. The dark blue and light blue are the 7-day and 14-day averages of community, just from the community cases. And then way down at the bottom, the orange and yellow are the 7 and 14-day averages of the cases from long-term care facilities. We can now zoom in to see what these last couple of months have looked like. It just gives you a better sense of the time frame of this. As we are in Passover now, many families are on spring break, and of course we have Easter this Sunday. Just please, again, ask everyone to be safe, be careful. We are absolutely not out of the woods yet. And of course, we've seen what's happened after other holidays where families gather together. Of course, everyone is so anxious to do that. And if you've been vaccinated, that's great. But if you haven't been vaccinated, please really think twice about these gatherings. We're almost there. We're almost to the end. We continue to have good availability of testing. So as always, I want to urge anyone who wants or needs to be tested to be tested. Our testing sites are open Monday through Friday for varying hours each day. So be sure to check the site. As a reminder, these are no barrier tests. There's no cost to the people being tested. You do not need a doctor's appointment. We will test people of any age, including infants, and you do not have to have symptoms to be tested at one of our sites. The only thing you do need is an appointment. In order to make an appointment, you can go online at montgomery.org/COVID-19 and click on the green county testing information button. And you can also register by phone at 610-970-2937. That opens up every day at 8:30 in the morning, and we do have language line available on the phone. One announcement for today, we do continue to hold vaccine town halls to provide our community with the latest information on the vaccine rollout and answer as many questions as we can. Our next virtual town hall will be held on Tuesday, April the 6th at 1:15 p.m. We've partnered with Montgomery County Immunization Coalition, the Senior Adult Activities Center of Montgomery County, and our Office of Senior Services for this town hall. To register, you can visit montcopa.org/town hall, all one word, town hall. Participation is available online through Zoom or our Facebook page and by phone. As a reminder, these events are no cost to attend and a recording will be available following the event. With that, I will just remind you all that next Wednesday, the 7th at 1:30 p.m. will be our next virtual briefing. And with that, I am happy to take questions.
Just as a reminder to our media partners, we have a limit of 3 questions per reporter today. We'll start with Todd Shepard from Broad and Liberty.
Good afternoon, Commissioner. As always, thanks for making yourself available through these press conferences. Could you go back to the registration system you talked about at the beginning today and just talk about how the county found it, what advantages you think you'll get by having the new registration system, and how long has it taken to get that going, and if you know of any costs, anything like that?
Yeah, sure. Great questions. So as everybody knows, the registration system that we had been using, which was a system that the Department of Health provided to all the counties that wanted it, had some problems with it. The biggest problem was that people were able to share links from it, and people whose it wasn't quite their turn yet were able to make appointments. So once we realized how much of a problem that was, we went to institute what we are calling a token system, where people had to enter a 6 or 8-digit code in order to make an appointment, and that made the links quite difficult to share. But the token system was a little complicated to use for a lot of people. Some people had some problems with it. So we knew that that was just going to be a temporary solution. A number of weeks ago, our team reached out to other providers, and we found a vendor working with a Microsoft-based solution. And we have actually built this system to accommodate our needs here in Montgomery County. And as such, we will also be able to tweak the system since it is something that we have some oversight and involvement with. And they have been working at breakneck speed on this. I think it's taken about 3 weeks for this to go live, which is actually quite quick when you're building something of this complexity. So we ask everyone to be patient. We believe that we have debugged the system. It's certainly possible that there might be some glitches in it. And if anyone has any problems, I want to remind them to just go ahead and email covid19@montcopa.org. But once this is up and running, we hope that this will be a much more secure system, much easier for our clients to use. And on the back end, some of its functionality will make it easier for my team as well.
And I apologize, I've not been at the last couple of briefings, so we may be going over something you've talked about before, but I guess if you could apply the same questions to the mobile senior vaccine units that you talked about, because I hadn't heard about those until today, just how long it took to get up and running and all that the county had to do to get that effort in motion.
So the mobile vaccine effort has been running now for about, I think, 4 weeks. I think this is the 4th week. We are running the mobile vaccination site out of our Department of Public Safety. That team is led by Dr. Al Wong, who is our Chief Medical Officer at the Department of Public Safety and the Regional Director for the Emergency Services System here in Montgomery County. And we were able to use some CARES Act funding to purchase a van and outfit it with the proper refrigeration devices for the vaccines. And Al and his team, as different paramedics on different days, are taking vaccine to senior living communities. So we know that some communities have already been served by some of the federal pharmacy partnerships, but we realized that there were other senior living communities that were not. So we started initially with senior housing that is income qualified, meaning that in order for an individual to live there, they cannot make above a certain income. And so that's where we started. Many individuals in those housing facilities don't necessarily have great internet access or laptops or good transportation, reliable transportation to get to a vaccine site. So that's been going very, very smoothly. We have about 37 or 8 of those living communities here in our county. We're just about done visiting all of them. And of course, we'll have to go back for the second dose. But it has been very, very well received. People have been so enthusiastic just to be able to get down to their lobby and be safely vaccinated. So we're very pleased that we were able to do that.
And then, as I'm sure you know, President Biden made a promise that all adults would be eligible to get in line. Qualifications, in other words, would be lifted by who could get in line for a shot on May 1. Given that you have so many 1A still outstanding, does it feel like the county is going to be able to get to that deadline on May 1?
Well, first, I just want to remind everyone that eligibility does not necessarily mean that we have a vaccine for you on that day that you become eligible. But the good news is with the governor's announcement today, and we are so grateful for this, we will be getting an allocation of about 25% of 42,000 vaccines here to the county. We believe every week, at least for several weeks, and it will be the Johnson & Johnson vaccine. It will be coming to our county health department. We don't know when it's arriving, but we understand it will be fairly soon. And we will be ramping up our vaccine locations to increase the amount of doses that we're giving at our sites every day. And this vaccine will also allow us to stand up some sites. I mentioned one in Pottstown. We're working to stand a more permanent site up in Norristown, really help us get vaccine out into our community where it's needed. So with these extra doses, if we continue to get about 10,000 additional doses a week, which we're hoping is what we're going to get, on top of the nearly 6,000 doses that we're already getting, then you can do the math on that. That should let us get through that 1A list in about a month. At the same time, President Biden has also announced that the federal government will be sending vaccine to a number of Rite Aid drugstores around the country. He has said that by the middle of April or the 3rd week of April, that 90% of Americans will live within 5 miles of a drugstore that has some amount of vaccine. I don't know if they'll have a lot of doses, but they'll have some. So I think between this effort here at the county And President Biden's effort to supply vaccine to many retail pharmacies, a month from now, we should be in pretty good shape and being able to start through many other groups of individuals in the county.
Thank you.
Our next reporter will be Jim Melward from KYW.
You just kind of answered the main question I had, but I'm wondering if you could give any more specifics. You expect 42,000 Johnson & Johnson every week to the 4 counties. Is there conversation about how that will be split? Would it be evenly among the 4 counties? Would you work together, or I guess, are there any conversations about how you kind of split that up among the counties?
I believe, and I'm not sure that this is finalized, but I believe it will be split equally across the 4 counties.
Okay, and
But you have to double check with DOH on that. But I think that's what's going to happen.
so that would be up to them, or would you guys
Yes.
kind of talk about it yourselves?
That would be up to them.
Okay. Any plans to use Johnson & Johnson? You talked about some of the mobile sites that you've gone out to. Any plans to use Johnson & Johnson for those specifically?
Definitely. In fact, this will be so helpful for us for a couple of different populations. We know that there are a number of homebound people in the county. And in fact, we have people calling our registration line already. And if this applies to you and you haven't done so, please feel free to do so. And registering as an individual who is homebound, or registering their parent or their grandparent. And we have been eagerly awaiting having Johnson & Johnson vaccine so that we only have to make one visit to the senior's home and that person will be fully vaccinated. So it will make it twice as efficient as if we had to go to the senior's home twice, and certainly much more convenient for the senior to only have individuals come in once. So we're extremely excited about that. And as soon as we know when we'll have the vaccine, we will start to make some plans to get vaccine to that population. Another really critical population is our individuals experiencing homelessness in Montgomery County. And so we are very eager to use the Johnson & Johnson vaccine for those individuals as well. And we will be looking at a number of vulnerable populations where it might make sense, just for the convenience of the individual being vaccinated, to have to receive only one vaccination. So this will just give us so much more flexibility and opportunity to serve everyone here in Montgomery County.
And with more people eligible now and more in the coming weeks, what's your advice to those people? Like, say somebody's in 1C, or say somebody's not in any of the phases but will be eligible soon. Should they start signing up now? Should they wait? What would you tell them?
So the governor's team announced today that 1B individuals will become eligible next week. 1C individuals will become eligible the following week. And then by April 19th, which was the date that President Biden set for all Americans to be eligible for vaccines, that Pennsylvania will move to that on April the 19th. I just want to say one more time, eligibility does not mean that we have a vaccine available for you, but we should in reasonably short order. So I think that it is reasonable for particularly 1B people to go ahead and start signing up. And maybe 1C people can wait a couple days, but they can certainly go ahead and start signing up soon as well.
Thanks.
Next, we'll go to Annie McCormick from 6ABC.
Hi, Commissioner. And again, I don't want to make you repeat yourself at all, but I just want to get a little bit of an idea of how many places in total you think, in regards to Montgomery County, there will be for people to get vaccines. And talking with the Department of Health, the pharmacies are receiving, they're still going to continue to receive their separate federal allotment. And the 10.5 thousand that actually, while I was on this press call, Barry from the health department confirmed that is how much each of the 4 counties will be receiving. That's on top of it. So out of the county sites that you have, in addition to the pharmacies that are involved in this, how many sites does that then make in your county that makes it available for people to receive the vaccine?
Well, I wish I could answer that question for you, but I just don't have all that information. So we'll be able to give you all of our county-run sites once we finalize where and when those sites will be, now that we know we have a much greater allocation of vaccine. What I don't have information about, because we are not involved in any of those decisions, is which pharmacies are getting vaccine. I do want to commend the Department of Health. They have on their website now, they do have a spreadsheet. It's a pretty big one. It takes a little bit to go through it, but you can absolutely see where vaccine is going every week in each of the counties now in a much easier way than you could before. So I want to thank them for that. It was certainly something that we've been asking for. What I have no eyes on is what the federal government is doing. So they are sending out vaccine. I don't know if that is publicly listed anywhere in terms of where exactly, which drugstores that vaccine is going to. So I'm sorry I can't give you an answer to that, but maybe over time, as the situation stabilizes, hopefully we would be able to compile that information and at least make that list easily accessible to people.
Okay, and then just my second question is more of a reaction from you. Just hearing this today kind of makes the battle that's been going on between the 4 counties and the Department of Health to get the vaccines to the county sites a moot point in a sense. How much of a relief is this, for your county?
I was going to start my answer by saying I breathed a huge sigh of relief when I got the news today. As you know, we have had just so many people so anxious to be vaccinated and looking to us for help. And we have, conveyed in every way that we knew how that my constituents needed vaccine. We have a very high take-up rate here in the Southeast. Many people want to be vaccinated, and we just didn't have enough vaccine to give them. So I just couldn't be happier. The biggest part of my relief comes from the fact that, as you heard me say just a few minutes ago, our numbers are really, really rising very quickly. I'm very concerned about the direction that this pandemic is going. Right here, as we're just about to the end, we see our numbers spiking up again. So the more quickly that we can get shots into arms and make sure that we make those vaccines easily accessible for everybody in our community, that's how we beat this thing. And now I feel like we finally are going to have a chance to get ahead of this thing because we'll have so much more vaccine here in the county.
Okay, and with that said, is there a certain point when you're looking at the numbers that you start to see how many people in the county have been vaccinated, and then you look at the numbers, even if they're numbers that are still relatively high, and you start to think, okay, we're at a good point right now because of growing vaccinations? Is there like a number that you have that would be a benchmark for you in regards to how many are vaccinated?
Well, I think the number that you're talking about would be the number that I would describe as reaching herd immunity. And that means that there's so many people vaccinated that the virus can't find, if the virus is within an unvaccinated person, in order for that virus to survive, they have to be able to hop to another human being that is not vaccinated. And so once we get to that herd immunity, that vaccine is going to have nowhere to go. And so it'll die within the person that it's in, which will be great. Not that the person will die, but the vaccine or the virus will die. So herd immunity is felt to be reached somewhere around 75, maybe 80% of the population having been vaccinated. So even though we've made a lot of progress, we're still quite a ways from that. Once we start getting into the 75% of our population vaccinated, I think we'll see just dramatic changes in the numbers of cases here. It will be very hard for that virus to be transmitted from one person to another because most people will be vaccinated.
Thank you, Commissioner.
Our next reporter will be Carissa Shoemaker from the Intelligencer.
Good afternoon. Just one question for you. Are you concerned at all that the rest of the state will get to the folks in the 1B and later categories before our region does? And do you think that should be allowed to happen?
Well, I don't know if concern's the right word. they're going to get to 1B before the Southeast does. It's happening already. I mean, we're hearing, I think Governor Wolf himself said the other day that there are unfilled appointments in certain areas of the state. So all of us here in the Southeast have been advocating for more vaccine to come to our region now for many, many weeks, because we could see that we still had a huge waiting list in all 4 suburban Philadelphia counties, and other places had no waiting lists at all. So I am just so pleased that there's acknowledgement of the fact that we all 4 counties still have quite a few people on our 1A lists. And we will be getting a very large amount of vaccine, these 42,000 doses into our region. And I think that will allow all 4 counties to, within a matter of a month or so, really move through our 1A list. So it's just good news all around.
Okay, thank you very much.
Next, we'll go to Katie Meyer from WHYY.
Hi there. Just one question. I was wondering, with the state preparing to loosen restrictions on restaurants and other facilities on April 4th, are you concerned that move is going to have a negative impact on the rising case numbers? And, would you push back on that decision at all?
Well, I know that the Department of Health is constantly evaluating the data across the state and looking at those decisions. And I would just urge people to be very, very careful. Certainly, if you have been vaccinated, and there's a considerable number of people now who have been, going out to a restaurant, assuming the restaurant's following all the mitigation rules, should be a pretty safe undertaking. But if you haven't been vaccinated, maybe just think twice about it, particularly if you're someone who would be at high risk for a serious case of COVID-19 if you were to catch it. I am less concerned now, frankly, than I was this morning, knowing now that we're going to have these very large numbers of doses coming into our county over these next several weeks, assuming that it does actually get here. I'm very hopeful that we'll be able to get a lot of people vaccinated in the very near future, and that will mitigate the risk that is going to come from relaxing measures. So as long as everybody keeps wearing their masks, keeps watching their social distancing, if the restaurants that do open with all of those strict mitigation measures in place, and we can continue to move through with our vaccine as quickly as possible, I'm hoping that we won't see complications from that.
And actually, one additional question, and this has kind of been touched on before, but, you guys have been pushing, the suburban counties have been putting a lot of pressure on the state for weeks now to change its approach to vaccination, to not use the PEMA sites. I'm wondering what you think, caused this finally, change in approach from state officials. I mean, was it the fact that a bill was introduced in the legislature? Was it just the sustained pressure? What was it?
Well, I think it was 2 things. I think that, and what I was told earlier today was that because President Biden announced yesterday or Monday this very large number of vaccines going to pharmacies, and many, many, many pharmacies, that everybody will be living supposedly within 5 miles of a pharmacy that has vaccine. PADOH felt less of a need to set up these regional mass vaccination sites. I think that was a big part of their thinking. I think also coupled with the fact that President Biden wants to make everybody eligible for vaccine by April the 19th, and realizing that in order for that to happen in the Southeast, we needed a lot more vaccine to come in our direction. So I'm just pleased that this is the end result, and it's what my constituents have been just demanding for weeks now, and I'm excited that we will finally be able to serve them as they have asked for.
Thank you.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Hi, Commissioner. I was wondering if you think the state's estimate today that 90% of people in the Southeast who are in 1A have been vaccinated already is accurate for either the region or Montgomery County. And are you concerned about anyone in 1A who's not being reached, or may not even be included in that count if you can't find them?
Well, I don't think it's anywhere near that in Montgomery County. I shared with you earlier the data of the individuals in our county that are 65 and up. And in that cohort, we're seeing right around 70%, probably an average of 69% of those individuals have been vaccinated. And that's been our focus. That's been except for healthcare workers, that's been the primary focus of 1A. So we're not seeing that here. I would also tell you that on our 1A list, as we work through it, we are seeing 40% or so of people telling us that they already have received vaccine somewhere else or have an appointment somewhere else so that they don't need our appointment. I would expect that number to be much, much higher than that if it was really 90% of 1A people have been vaccinated.
Great, thanks. And so, I mean, as people have mentioned, there was so much frustration in the suburbs for the last several weeks, and a lot of pressure coming onto DOH. As you alluded to, even when DOH announced the J&J today, it wasn't framed as a decision being made because they had listened to the counties. It was more because the feds changed their program and made this, what they decided to do to ditch the mass clinics. So at this point, do you feel that, aside from the vaccine supply itself growing, which is thanks to the federal government, has the Department of Health, listened to or addressed any of your major concerns from the recent weeks?
The bottom line is we needed more vaccine here in the Southeast, and now we're getting more vaccine. I couldn't be happier about it, and I look forward to a collaborative relationship going forward.
Okay, thanks. And last question, are you concerned that there will be the same crush of demand with the expansion? Are you worried that people are going to still be on websites, at midnight looking at 5 different providers trying to secure appointments?
Well, there's still no central registration site, so it is possible that that will continue to be the case. I hope that that is relatively short-lived as we see so much more vaccine come into our region. Not only will the county have a lot more vaccine, but presumably from the federal government's plan that President Biden is putting into place, there will be many, many more pharmacies that have vaccine. So hopefully, once that initial crush is over, it will be much, much easier to get a vaccine appointment. That's everybody's hope.
Our next reporter will be Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioner. Now that you said all the key indicators are going up in the county, is there any sign that the UK variant is becoming the predominant variant in the county as these cases increase?
I can't tell you if it's the predominant variety because there's not enough genomic sequencing being done to answer that question. What I can tell you is that as of a few days ago, we were up to 47 cases that had been identified or confirmed to be with the B117 variant, which is that British variant. If there's 47 cases, I think we just have to assume that there's a very large number of other cases that we just haven't identified. But unfortunately, I'm not able to to answer whether or not it is the predominant strain.
Okay, that's all I had today. Thank you.
Thank you.
There are no further questions today.
All right, thank you, everyone, and we'll see you next Wednesday.